Planning the birth of your baby can be overwhelming, especially for first-time moms. But don't fear, because today we have with us one of the most popular childbirth educators that we have in the Philippines, Ms. Chicky Rosas-Han, and she will help us come up with a checklist that will be so helpful in planning our childbirth. Hi, Ms. Chicky!
Hi, hello! Naku, thank you so much for inviting me.
Thank you also. This is partly a dream come true for me, because when I was about to give birth to Philip, talagang I wanted to be in your classes. The schedules just didn't match, but like what I said earlier, for my second baby, hopefully,
yes.
ikaw na ang kasama ko. Okay, so we have a checklist, and actually, this is a longer version, but we've made it the 5 most important things on your checklist. So I'm gonna go through them one by one, and you're gonna explain to us what that means. So first is attend birth classes. So what does that mean?
Most of the mothers kasi, when the ones that attend my class are first-timers.
Okay.
And every time I ask them, what's the first thing that enters your mind when I say childbirth? Guess what? Fear.
Yes.
Fear. Okay. So for them to be able to not be so afraid, they need to know what's going to happen to them. And they need to decide kung may coach sila o wala. So they need to attend the classes para ma-brief ko sila, kasi hindi masyadong kompleto na bibigay ng doctor lahat ng information na gusto nila.
Of course, the doctor naman is there lang for certain purposes, but I guess the birth class is there to inform them of so many other things that they have to think about.
Sobrang dami.
So what kinds of things do you teach in your birth classes?
Dami.
So
dami. Phases of
lang.
labor, stages, when to take the mother to the hospital, how do you do the breathing. Then I tackle what is the role of the coach, para at least when he gets there, he knows what to do, he doesn't faint, he knows what to expect, saan siya tatayo, ano yung mga questions na itatanong niya sa doktor.
So important talaga the husbands attend this as well.
Yes. And then, syempre, when to take her to the hospital. Yun ang gusto nilang malaman. So they're eager to know what are the signs of labor, and then when labor gets painful, ano yung mga positions that they can use, what are the massages, how you can speed up labor, how to turn a breech baby. So
wow! Okay. So pretty much marami rin talaga. And you have like a total of 4 meetings, right?
Correct.
Second item on our list is actually coming up with a birth plan. Actually, when I was about to give birth, I found out that not a lot of moms knew that there is such a thing called as birth plan. So a birth plan is...
Okay, so this is like, it's not really a contract, but it's like an agreement that you come up with together with your doctor or your care provider, midwife, and then you kind of run through with her what are some of the things that you like to happen in your birth, and then likewise, during the course of the conversation, malalaman mo ano yung pwede, ano yung hindi pwede, pwede ba ako maglakad, pwede ba akong kumain, naka-dextrose ba ako from beginning to end, yung monitor, pwede bang intermittent, pwede ba babae lang ang mag-a-IE sa akin. So, lahat ng mga gusto ng mom and what she's comfortable with, ilalagay niya sa birth plan.
So parang, let's just think of that as personalizing the kind of birth that will make you feel comfortable, right? So it will help them overcome the fear. And you also teach this in your classes, right?
Yes, parang game plan.
Oh, galing. Okay, so take note of that, moms. You need to have a birth plan. It also helps. Ako, nakatulong talaga yun sa akin to overcome my fear as well.
Yes.
Now, the third thing on my checklist is know your birth options. Okay, what does that mean, birth options?
Marami. Some others want to give birth in the water.
Yes.
Some want to give birth, well, the normal on land. Some nakaschedule na, gusto nila CS, walang pain. So parang from there, you can actually talk to your doctor, find out ano yung mga options you have. And then based on what kind of birth you want to have, you want to find out if the facility offers, let's say, meron bang pool where she can actually have her birth. Or can she just labor in water and then give birth on land? Right? I mean, on the bed.
On the bed?
Not
or in the cab.
Diba?
So I think what's important here is that they know, they must know that there are options. They're not tied to just one kind of birth, right?
Correct.
Okay, the fourth thing on our list is stay healthy. How do we do that when we're pregnant?
Yes, so sobrang dami. I always tell them 2 things you're responsible for. Your health. So you need to be able to eat healthy.
Okay.
Kasi dapat masustansya yung kinakain mo para yung baby is also healthy when the time comes. He's so strong, so you can actually push him out, and he likewise
endures that as well.
Yung process of the whole stress of labor. At the same time, exercise. So a lot of the mothers like to eat. Eat and sleep.
I know.
Lalo na on the latter months. and you know, you don't really know how long labor will be, and so you need to build up on your endurance. So exercise is very important.
Quickly lang, Miss Chicky, ano yung what's the healthiest form, or what's the best form of exercise for pregnant?
Walking, yeah. Number one is walking.
So simple walking. You don't even have to go to the gym. Just walk around your village or your area.
Kasi you have to strengthen yourself para yung endurance mo mahaba.
That's right.
Kasi kung 24 hours of labor, pag bumagsak yung endurance mo, mas lalong babagsak rin yung pain tolerance mo. So parang mabilis kang hihingi ng anesthesia.
I agree. A lot of women don't they think that you're just gonna lie down and give birth.
Yes.
But it's actually a whole lot of work. Okay,
Correct.
so the 5th on our list is called do a hospital tour. So, ano ba to? Pupunta lang tayo sa hospital? What's that?
A lot of people don't really realize that they need to go. Kasi you want to be able to see where you're going to give birth. And parang if your husband is going to bring you, you can't be the one telling him where to go because you're in pain.
Yes,
so you have to both do it together. So basically, I tell them, you do a hospital tour, the area where you're going to be giving birth. So kung executive, let's say for instance, let's say yung Lamaze room, right? O yung birthing suite. Saan? Anong floor, right? So normally kasi you go there, you do not reserve a room, you go directly to assess kung are you in labor or not. So they need to know where that is. And then syempre if the baby has some special needs, so they need to know where the nursery is. And then of course, yung budget nila, 'di ba? So kailangan nila makita yung mga kwarto, magkano yun.
Correct.
Kasi yung fee ng doctor tsaka lahat ng mga procedures nakasalalay doon sa room na kukunin nila.
Pati yung protocols, I guess, no? Parang ilan ba yung people allowed? Is your husband allowed? And many more other things I actually discovered when I did a hospital tour. And I also did a tour in a bahay paanakan. If you actually are considering like giving birth via midwife or bahay paanakan at your home, you have to do a tour as well. And basically, I think what this checklist is showing me and the knowledge that you've shared with us today, Miss Chicky, is that birth is not something that just happens, right?
Yes.
You have to prepare for it beforehand. And we are so grateful for the 5 things that you have shared with us today. And I'm pretty sure we will learn. Ako, I'm excited. I want to learn more from you.
On your second baby.
Oh, hopefully on our second baby, maka-attend na kami ng classes mo. So thank you for spending time with us. And I wanted to ask, if they want to attend your classes, where should they go? How will they find out about it?
So they can go to my website. It's chickybrosas.blogspot.com. And then my phone number is 0917-88-BIRTH. So it's very easy to remember.
88 birth.
88 birth.